Golfer's elbow or medial epicondylitis can be a really debilitating injury. Anytime you grip something, especially a golf club or a tennis racket, you can have this strong pain, and for some people, it's unremitting. That pain doesn't go away even between activities. But luckily, it's a relatively simple fix, even if it's not necessarily easy. The muscle most commonly involved in golfer's elbow is called Flexor carpi ulnaris. It starts here at the point where most people have their pain on the medial epicondyle, and it goes down and attaches just past the wrist onto the pinky side of the wrist itself, which most people think of as the base of the hand. Now you can do a quick test. Make a fist, flex your wrist, and point it towards your pinky a little bit. Use your other hand to try to get yourself out of that position. If that brings on your familiar pain, you definitely have medial epicondylitis, and the muscle to blame is our friend the FCU. The simple fix to this is the same as we use for almost any soft tissue injury. Smash it, stretch it, load it through a full range of motion. So we're gonna get right into that. That little flex the wrist, move it towards the pinky and try to break, that is a good retest that we can come back to. And we know that if that brings on your pain, then if we do some stuff that makes a difference, we can do that again and it's gonna hurt less. So make sure you check in beforehand. All right, that's where I'm at right now. Maybe I'm at a 6 out of 10 with that. We're gonna do some stuff and then hopefully that number will go down. First, we're gonna do the FCU Tack and Stretch. I'm just gonna root around here in my forearm on the lateral side. And what you'll find, you can see for me, there's almost like a little rope I'm going over there. And that's what it's like for most people, even people who don't necessarily have symptomatic golfer's elbow. That's just a muscle that gets really tight. So I want to find that steel cable of the FCU, and notice I'm a few inches away from my elbow. If I touch right in here, it's going to be really painful to push on. I want to go a little bit away where I can feel a tight, tender muscle, but it's not really aggravating my elbow pain. So what I'm going to do is push on that muscle, and I want to get a firm hold on it. I don't want to slip off to one side or the other. So I'm pushing down with my thumb on the other hand. Then I'm going to contract that muscle by gently making a fist, flexing at the wrist, pointing it towards the pinky like we just did. And then I'm going to stretch that muscle by opening up the other direction, extending my wrist and moving towards the thumb. So I'm just going to go back and forth. Breathe in through my nose, contract that muscle gently, and then breathe out through my mouth or my nose and stretch that muscle, open it up. I can repeat this 10 to 15 times. It should start to decrease in intensity of sensation as you go on. And once that spot starts to get a little better, then I can move a little bit farther away from the elbow and pick a different spot that's still on that same muscle. Notice, as I mentioned earlier, we're working a little bit away from the elbow joint. When you have something that's a tendon injury, like medial epicondylitis, what happens is that there is damage to the insertion of the muscle here at the elbow. That comes from excessive tension in that muscle as it gets tight over time. The reason we're loosening away from that area is to feed some slack into that overly tensioned, injured tendon. So I'm just gonna do a couple more of these. Breathe in, contract, breathe out, relax and stretch. All right, that's good. For me, I don't really have golfer's elbow right now, but I can already feel that that's a lot less tense just after doing a few smash and stretch with the thumb. So next, I've got my floss band here, and what I'm gonna do is do a little voodoo on this forearm compartment. I'm gonna grab onto one end, get a wrap about 6 inches above my hand here, not so tight that I'm cutting off all my blood flow. I'm gonna wrap up from here to just above the elbow. And if you've seen these videos before, you know we're overlapping 50% of the previous wrap, and we're doing about half as tight as we could wrap at a maximum. This is a real tight and sensitive area, especially if you're suffering from medial epicondylitis, so don't go too tight if it's your first time. We just want to get a little compression in there. Okay, tied off. Just went right around the elbow, but I got as much of that tissue as I could up to the medial epicondyle, this little bony prominence here where the pain is. What I'm gonna do here is do that same motion, flexing at the wrist, tilting it towards the pinky slightly, while also flexing the elbow, and then going back out away from that. I'm just gonna move around here for about 2 minutes, and I wanna also try to get a little bit, stretching into a little more wrist extension, and I'm pulling across away from my pinky with my other hand. That really stretches the FCU to its end range. So I can flex, open up, just play around. You can even, if you want, put your hand on a solid surface, work on extending your wrist. And again, we're kind of deviating away from the pinky side. It's called wrist extension plus radial deviation to stretch out that injured tissue. But I'm just doing this. I don't want it to be painful. I don't want to bring on my pain, but it is going to be maybe slightly intense or just kind of a funky feeling. If you get any tingling in your hand or they start to get cold, take it off. But 2 minutes is the maximum. Then I'm going to take it off. My forearm is going to turn a nice shade of pink here as the blood flow returns to that area after I kind of squeezed out a lot of stuff. Then I can do my retest again, and now it's really starting to feel much looser and less stiff through the elbow. Now, we want to do a couple exercises to strengthen that muscle and strengthen the tendon. Number one is the towel twist. You can do this with a simple towel. There's a physical therapy product called a TheraBar that's also great for this, that gets a little more resistance, but a towel is just fine. So again, we want to remember the movement we're trying to strengthen, the muscle we're trying to strengthen, does a movement of wrist flexion and ulnar deviation, or moving towards the pinky. So to do that movement combined, there's a functional movement that almost everybody does, which is wringing out a towel. If I wring out a towel, I'm going to automatically flex my wrist and deviate towards the pinky. So we can just do this, wringing, focusing on flexing or pushing down with the side that you're trying to strengthen. Again, within pain tolerance, no pain while you're doing this. We just want to activate that muscle and begin to strengthen it. So I'm going to do 10 to 15 reps here, or until I start to feel fatigue in that forearm muscle. And it's totally fine to balance this out, because a lot of times people have weakness in the extensor compartment as well by doing a few reps going the other direction. The next exercise is called the wrist flexion eccentric. Eccentric loading, which is where a muscle contracts as it gets longer, is really important when you have a tendon injury, whether it's tendonitis or tendinopathy, because one, it stimulates the muscle that attaches in there to get stronger but also lengthen, and it stimulates the fibers of the tendon to reorganize. When you have an injured tendon, those fibers can get all gnarled up in there as they try to heal the injury. What we want is those fibers to be nice and organized and able to withstand a lot of force without pain. So the wrist flexion eccentric. I don't need a fancy dumbbell. I just have a full thing of dish soap here. Anything that weighs 1, 2, 3 pounds, whatever you can do without pain is fine. I'm gonna help myself up. So I'm gonna help lift this up, and then I'm gonna slowly lower down as far as I can. Again, help up with the other hand and slowly lower down. Just choose a weight that is okay for you. When you're doing this, choose a weight that is challenging but doesn't bring on your familiar pain. And it's important to support your forearm on some kind of a surface just so that you isolate the movement of the wrist and we don't end up doing a bicep curl. So I'm gonna do this probably for 10 to 15 reps, or again, until I start to feel fatigue in the forearm. All right, our very last exercise is called the 4-way wrist stretch. I'm gonna get down on all fours, start with my hands on the ground and my fingers facing forward. And I just wanna gently come into a stretch here, moving my shoulders forward. My elbows are extended as I do this. I'm gonna hold for 15 to 30 seconds, and then we're gonna do 4 different positions. This is an all-around wrist stretch. The most important one is gonna be the last one. I'm gonna do it a little bit shorter for the sake of this video because I just wanna show you the 4 positions. Next, I point my palms up and then my fingers back towards me, and to get into the stretch, I rock back towards my body. That's more of a wrist flexion stretch. But again, most people who have some kind of a wrist and forearm dysfunction are missing all different ranges of motion, so it's good to work on. Next, I'm going to flip around so that my fingers are pointing towards me and my palms are down with my elbows straight, and just rock back a little bit. Again, no pain here. We just want to get to where you have a gentle stretch and hold for 15 to 30 seconds. And then the last thing and the most important thing is I'm going to have my palms down and I want to turn my hand inward. Now you may just want to do one hand at a time at first as you get used to this if you're limited in range of motion. If you can do both hands together, that's great. But this really, where we have wrist extension, plus I'm doing radial deviation, I'm moving towards my thumb as I get into this stretch, is gonna really target the flexor carpi ulnaris, which again is our problem muscle for medial epicondylitis. So 15 to 30 seconds on each of those 4 stretches, which is a nice way to cool down after doing all of the wrist work that we just did. So that's your simple fix for golfer's elbow. Give it a try. Leave a comment below, subscribe to the channel, let me know how it goes, and I'll see you next time.